When the topic of mental health first aid came up in adult religious education, I thought it sounded like a great idea. But what I didn't realize is that it's a real program, that people are teaching people how to be first aid providers for mental health. I have not done that training, although it sounds like a great idea. But Jim has, and he's going to tell us some about it, and we're going to have a chance to talk about it.
Thanks so much. Yeah, the purpose of this forum is a few things. One is to remind us all that mental health problems are extraordinarily common. Two studies show that they're more common than heart disease, lung disease, and cancer combined.
Wow.
And of course, what this means is that if we don't experience such health situations ourselves, we certainly know people who do. And so another purpose of this forum is to encourage each of us to be caretakers in our communities, not just of ourselves, but with each other, and also to provide details about trainings that are available to help us in providing support to people who are in distress. Just as none of us were born knowing how to administer CPR, so it's also true that mental health first aid is a set of skills that can be taught. I am not a mental health first aid trainer. These folks who do provide this training are certified, and but I have gone through the training, and I did so because I started volunteering maybe 4 years ago now at UT, where I work, with the Victim Advocate Network, which assists students, staff, and visitors who are either impacted by crime on campus or by distressing events on campus. As part of the required training, I took 8 hours of in-person training on mental health first aid. And so before we go any further, I want to share some details in the chat, and obviously this is hard to provide in person to those of you in the meeting house, but it's important, I think, to share details about professional resources that are available to us, including the National Suicide Prevention Lifeline, which since June of this year has been a 3-number code. You can dial 988 nationally and be connected 24/7 to a suicide prevention specialist. There's also still an 800 number, but 988 is the number to reach. If you're in Travis County, there's a crisis support line run by the folks who do the training that I'm going to mention. And that crisis support line is 512-472-4357. And that's available 24 hours a day, 7 days a week. If you're in Texas, but you're outside of Travis County, thank you. Blue Bonnet Trails runs a 24/7 crisis line, 800-841-1255. And then the last hotline, which I'll share, is the Trevor Project, which is for LGBTQ youth, and that's 866-488-7386. Like I said, I'm not an official trainer for mental health first aid, but I was really impressed with the services and the resources that are provided, and through the mental health first aid. And I'd like to share a flyer, which I'll just scroll through. Mental health first aid teaches you how to identify, understand, and respond to signs of mental health and substance abuse challenges among adults. And it says, who needs to know mental health first aid? And you see a list of folks who you might expect would need to know: employers, police officers, hospital staff, first responders, but also caring individuals. In other words, these are skills that all of us could benefit from knowing, because as I said earlier, we all are going to know. The statistics are very high. All of us are going to know folks who could benefit from a caring ear. The training covers common signs and symptoms of mental health and substance abuse challenges. It covers how to interact with a person in crisis, how to connect a person with help, and content on trauma, substance abuse, and self-care. And they've got this acronym, which I'll share a little bit about. ALGE. Assess, listen, give reassurance and information, encourage in various ways, and there are multiple ways to take this class. I did it pre-COVID in person for an 8-hour session, but there's also an opportunity to do it in a blended way, where you do some of it self-paced online, and then you do some of it in person. And this change was, of course, due to COVID, but they offer the training fairly often in Travis County through this company called Integral Care. The things that that I would say this training does is increase a participant's sort of self-confidence in feeling like you have something to offer to someone who's in distress. It's a common experience to sort of not know what to say, and there's a lot that we can do, even without being, certified trainers in mental health first aid or licensed clinical social workers. And so this ALGE action plan is worth talking a little bit about. I'll go through each of these and then stop. And maybe I'll just stop sharing my screen for the moment. Assessing risk of suicide or harm can be as straightforward as just asking a direct question. Are you having thoughts of suicide? Are you having thoughts of killing yourself? If you ask a direct question, you'll more often than not get a direct answer. If the answer is yes, then you might probe a little deeper. Have you decided how you are going to carry out a plan? Have you decided when you might do this? Have you collected the things you need to carry out a plan? And if the answer is yes, then crisis lines are the appropriate response. 988. Therapists aren't necessarily going to be providing the sort of help that a person needs. These are circumstances where we really do want to reach out to trained professionals. And it's also worth, just right off the bat, starting with saying that it is appropriate to call 911 if someone is overdosing, if there's been poisoning, if there's a life-threatening emergency, if someone is confused or disoriented or unconscious, actively bleeding. I mean, in all these circumstances, 911 is the appropriate response. 988 is appropriate in cases when that first step, assess, leads you to recognition that the person that you're interacting with is active, engaging in active suicidal ideation. But there's a lot of levels of distress that have nothing to do necessarily with self-harm, and that's where the rest of the acronym comes in. If you're with someone and they're not in a actively suicidal, listening non-judgmentally is incredibly important. And body language and nonverbal cues have a lot to do with what non-judgmental listening amounts to. Not obviously, you want to not be interrupting people, but you want to be accepting what you're hearing and kind of just be genuine and empathetic, attentive, keeping comfortable eye contact, and open body posture, not crossing your arms, or you want to maybe be seated next to the person rather than, so you're with them rather than sort of sitting right across from them, which might feel a little confrontational. Attitudes are key. And the training is really helpful because there's some role playing, and the training can help you feel like less like fidgeting under such circumstances, or less like nervous with just being with someone and sharing their discomfort. But listening really needs to start. Listening non-judgmentally is sort of the second most important thing. Giving reassurance and information is the next item in the ALGE acronym, and so some of this is about offering some consistent emotional support and understanding. Sometimes symptoms are just an expression of an acute circumstance of distress. Sometimes they're part of an ongoing illness. The giving of reassurance sometimes can be just as easy as letting someone know that they're not always going to feel this way. But in fact, sometimes what is more helpful, or just as helpful, is providing information about services that are available, practical help, credible information. So these hotline numbers can be very helpful. Because we're, as caring individuals who want to provide support, we're not going to be in a position to answer or provide all of the support that's needed. And so mental health first aid is a little bit like, the analogy that they use is that it's sort of like it's the first aid you provide until the professionals can arrive. And so giving reassurance and information is helpful. So part of that is encouraging people to seek appropriate professional help, and that can be a barrier to some who are experiencing distress. But there are steps that we each can take that are associated with self-care that don't mean that you necessarily need to refer someone to some elsewhere. But there are steps that each of us can take that include exercise, meditation, peer support, activating family and friends and social networks, encouraging people to engage in the kinds of activities that will help, will be healing and will help people get through a circumstance. And part of that really is about being willing to know when you need support. We all react differently to traumatic events. Sometimes traumatic events can pass, but if some weeks pass and we're still experiencing, or people that we care about are still experiencing, kind of impacts, then that's a good sign that some additional professional help is required. But this acronym ALGEE is a good shorthand for kind of the tools that we might benefit from having in our toolbox, in our mental health first aid kit, for helping others. I'm going to stop here and ask Mary to see if you'll add anything, and then see if we've got questions, and we can then talk about the training itself.
Talked about this. It was clear to me that this really is a first aid technique, as in if there's an urgent situation and you come upon it, what do you do? My own experience is more walking in the middle of something ongoing. And I think the algae points probably still apply, but I was a home health occupational therapist for 20 years. I would go to somebody's home and I'm there to treat them because they've had a stroke. When I get in the house, I discover they're also a hoarder. And there's not a safe pathway to walk around whether or not you had a stroke. At that point, you begin to figure out how you apply the same kind of things, because that may or may not have appeared in the information you got. Or you go to visit a friend and you say, "How are you?" And they say, "No, I've been really depressed for the last several months." At that point, what do you do? Back to you.
I have a couple of books. There's a publisher who wrote, his first book was a kid's book about race. And they have expanded their number of books. And there are two books, a kid's book about anxiety and a kid's book about depression. And one of the things that they mention several times for the kids anyway is to say, take a breath, and are you okay right now? The immediate, you're not, none of the trauma, the stuff with bleeding and injury or that kind of thing. But are you in your body right now okay this instant maybe? You still may be worried, but your body's here, you're talking, you're okay right this minute. And I think that is helpful for especially for kids, because the instantaneousness of something.
Well, and adults get to where,
Yeah,
right this moment, everything's too much.
yeah. So anyway, that was my contribution.
I worked on the hotline over 30 years ago. And at that time, the most difficult customers we had were borderline people because we could never tell whether or not they were just toying with us, calling up because they were bored or they were in an acute crisis. Has any information come forward in the last 30 years that makes that discernment easier?
Yeah, I don't have an answer to that one. That's a good question.
Oh, the phone would be tough.
Yeah, I mean, one of the there's sort of two things that discussions like this, I think, at their best can do, and one of them is to destigmatize the issue of mental health, because that can be an obstacle to seeking help and assistance. So if we're a little more open about talking about this as a very common thing that all human beings experience, that can help. The other thing is to encourage us, to those of us who care for others who may be experiencing these sorts of distressing bouts of depression or anxiety, is that there are things that we can do to help, and so the seeking the training can strengthen us to play a healing role with others, particularly for acute or distressing events or circumstances that might be not chronic. I also served on a suicide hotline about 30 years ago. And one of the things that is true now is that there are more of these sorts of hotlines available, and there are hotlines available that are general and or specific, or are geared towards specific communities, and that helps. But Larry, I don't have an answer to your question. I think it's a good one. One other thing which I'd like to share is the training schedule for mental health first aid, and I'll share my screen again. Let's see. I've put into the chat a link to this Eventbrite webpage, but Integral Care is the name of a nonprofit here in Travis County that is certified to provide mental health first aid training. I mean, if you just Google Integral Care Mental Health First Aid, this will pop up. But there's a little bit here about the 3 options: 2-hour self-paced, 6-hour online, 2-hour self-paced, 6-hour in person, 8-hour in person. If you live in Travis County, this is free. And I'm just going to scroll down here to show the upcoming opportunities. There's a virtual training on December 6th for mental health first aid for adults. There's an in-person mental health first aid for service members and veterans and families on December 14th. And if we move forward into January, there's an in-person day-long January 16th training for mental health first aid for adults. And then there's some other, I think the others are for youth or for service members. But if you click through, you can sign up, and I'll just scroll down to about this event and point out that you can get continuing education credits if you're a licensed clinical social worker, but of course, they'll ask for household income, but they only ask for it for their grant purposes. It is free if you live in Travis County. If you live outside of Travis County, it costs $25. I am interested in this about hosting a mental health first aid training. And one question that I have is whether, in fact, we ought to, as a meeting, obviously encourage members and attenders to take the training, but maybe we ought to consider hosting it. And so that's one of the questions that I wanted to bring to the meeting is this a resource that we might provide to our members and attenders, or is there, maybe that's a sort of a medium to long-term question. If there's someone or multiple people who wanted to take the training and give their own assessment of that as well, because it's been I think 3 or 4 years since I've taken it. But what could we be doing as a meeting that we're not currently doing if more of us were trained in mental health first aid? That's one question. And then another question is, could we or should we, host a training, a group training?
Something I wonder about is, would it be, could it be something to offer to the local neighborhood community? And, go around our neighborhood and see if people would be interested as a service to our community.
Check with some of the other churches in the neighborhood.
Jim, do you have any idea what a minimum group size would be for them to have a dedicated, training for us or our community?
I don't, but I'm happy to find out.
I think that'd be useful for us.
Mm-hmm. Great.
Might also be a good opportunity to connect with the neighborhood association that we're trying to generate connections with, as well as other churches.
Another question I'll ask is whether, thank you, Erica, for your suggestions about those books, and thanks, Larry, for your question about suicide prevention. Are there others with suggestions or experiences to share around this topic? Because it's destigmatizing it is important, and being willing to speak openly in a caring setting is also important.
So I worry that often the people who are closest to the mentally ill are the ones with the least amount of, is it empathy to the problem? I don't know. Mental health is rather like physical health in that it must be nurtured. You, in passing, mentioned meditation. You, in passing, mentioned exercise. And so I think when you're very close to someone who has high blood pressure and they eat steaks every day and they don't exercise ever, it can be difficult to generate the empathy for, their health problems. And so it is similar with mental health problems when, someone is saying, I'm different, I'm troubled, I have all these problems, and you're saying, well, you need to meditate, you need to exercise, you need to work. You can't lie in bed every day. And then they say, well, but I have all this fatigue. And you're thinking, well, you're fatigued because you haven't got out of bed for 2 months. And then they start, slowly over the years to just really prove that they have problems that are mental issues. And then eventually, it deteriorates to where maybe this first aid stuff that you're talking about comes into play. But I think all of us know people and have known people who we just watched their mental health deteriorate over the years. And it's hard to understand why they won't help themselves. I'd love to hear someone talk about that, which is not like I'm meeting a stranger for the first time. It's more like the people who we know and love. I certainly have friends who've dropped off the face of the earth, and those are like psychotic breaks. But, I have a cousin who's been trying to convince me since she was in 3rd grade or something that she's mental. And yeah, she's mental. So we all have a friend who we worship with, who, we've recently, had to ask him to leave this community. And we've watched the deterioration of Carrie's mental health. No stigma, no judgment. These are people who we know and care about, and they're part of our lives. What do you suggest, as you watch someone not lift a finger to help themselves? And oftentimes drug and alcohol use is all mixed in. And that's part of why it's hard to have so much empathy for someone who won't get a job, won't get off the drugs, won't do anything to lift a finger to change their mental situation. We've all had trouble going to work, getting out of bed every day to go to work is not like super fun every time. So anyway, that's, I just want to bring up like the more normal situation. I've never been on a suicide hotline, but I've definitely watched, people's mental health go up and down, and sometimes right here.
There's a saying that health professionals are very familiar with about the doctor who treats himself has a fool for a patient. The therapist who treats herself has a fool for a patient. That's in terms of recognizing and being effective and being your own caregiver at times. When it's somebody close to you, I think there's almost the same issue. First of all, you have a good deal of denial. That anybody that I've known and loved for 10 years or 50 years could possibly have this problem. And secondly, your patterns are very set. This is a good time to get an outsider in, hopefully an outside professional.
Yeah, I can't speak highly enough of this training because it's taught by licensed clinical social workers who have experienced the gamut of clients' behaviors and situations. Self-care, especially for those of us who are caring for those with mental health issues is incredibly important. And that's covered.
Were there?
There we were. I've had, unfortunately, lots of experience with people close to me suffering from manic depression, alcoholism, bipolar disorder, most recently a cousin who's suffering from severe paranoid delusions. And I haven't learned a darn thing, I don't think. I always find that these are the people least amenable to advice. And they're the people who can only be helped when they seek help themselves. But part of their syndrome is the inability to recognize their problem and seek help. It's a vicious circle. And, and I'm not sure I learned anything except that you need to be there for them. You need to be ready with the advice should the opening occur that they are open to it. You need to learn yourself where are the sources of help for these people so that if the opening should occur, you will be able to lend a hand and guide to the best of your ability. But it's more about preparing and waiting for that fortuitous moment when there's some breakthrough. That's all I can figure out.
In my experience with situations like this, one of the first things I think that I found that makes it more likely there's an opening or a connection is when a person feels heard. When a person who's going through difficulty feels like the message that they're sending is getting through, or that they are getting some kind of supportive relationship. And so treating that person who's in great difficulty with this basic sense of respect for who they are and what they're going through at the moment seems to me to be essential. Advice is generally not helpful until, as Terry says, that moment comes. And sometimes it doesn't come on our time schedule. The tricky part is knowing when is it behavior enabling that to continue, and when is it being there for the moment when the beneficial effects might take place. And that's not easy to say, especially when you're connected personally with the situation. But it seems to me that unless somebody feels at some level that they're being treated respectfully and with listening, that it's less likely to happen.
10 minutes.
Thank you. We have 10 more minutes, Jim.
Okay, Tobin has brought up the concept of enabling, and that's a really, I mean, that word has so many implications, and there's so much to that. And the situation I was saying where we know these people, we live with these people, we're friends, family, and Terry, I found what you said very helpful, and it connected to what Mary said about an outsider. You can connect them to the outsider when they say, help me. So that's fantastic. Place to sit in waiting, not being a professional, knowing that there's something that you can do. You can at least get preparation with the action plan of phone numbers. But while you're sitting waiting, how to not become the enabler when people are constantly asking for your help to push the boundaries and the limits and change all of the social contract by which we generally live. Give me money so I don't have to earn a living, which would be mentally healthy to get out of bed and go work. Give me what I need. Give me what I need is what the constant cry from these people is. And yet, how to not become the enabler that we see our other family get stuck in. It's just really obvious that that's what's happening. They're being used. And it's not good for anyone.
Because I got here late. I suffer from mental health issues. Nothing enough. Psych hospital 3 times in the last 3 years. And one of those times the police got involved and it was not fun. So before you call the police in a situation like that, I know that's not always the, you don't have a choice maybe, but try to be there as much as you can, call other people, other healthcare workers. There's got to be other options because the police come into the situation and it's almost like a militarized, and all they know how to do is just, full force, deal with it. And like I said, it was not a fun experience. The other thing is, I know that one of the times that I called my sister and I was out of it, and I'd gone off my meds for quite a long time, and I can be off my meds for a long time, and then all of a sudden I hit a brick wall, and I have this dissociative state where I go into just big time depression for months on end. And when I'm in that kind of mixed state, because I'm bipolar, I totally dissociate from myself in reality. And I called my sister up and I was out of it. And she said, should I send, her husband over? And I said, no. And I told her later on, if I ever call you and I'm in that state, don't hesitate, just send him over here. So if you know of a person that has these kind of issues and they call and they're out of it, and you're good friends with them or a family member, go be with them right away. So, and not all hospitals are, one of the hospitals here in Austin is lousy, if you ask me. The other one's not so bad. But anyway, that's my 2 cents.
The hospitals that's bad and one that's not so bad. Can you tell us the names?
I had a worse experience at the lakes than I did at Barton Creek.
Barton Creek is okay. Thank you. Thank you for sharing.
Yeah, thank you so much. The one thing that I would add is that since this calendar year, there is a 4th option in Austin. When you dial 911, they say, do you need police, fire, EMS, and now more mental health professionals? So yeah, keeping the police that 4th option is very important.
Question for Jim and for others. I'm wondering how you see your training and work and study in mental health first aid. How does this relate to your spiritual life within Quakerism? And do you see a distinction between that sort of more therapeutic side and sort of religious life?
Thanks for that question. I don't really know how to answer it except to say that seeking training to be better at this kind of thing. Feels like the right thing to do. But maybe others have something to add.
It seems to me that learning more about this and being ready is about looking for that of God in the other person and being as open as humanly possible to where they are. And that seems to me to be very spiritually oriented.
It's really not at all uncommon for a friends meeting to have one or two people in our midst who suffer from mental disorders. And somehow we have to be aware of that as a community in the way that we can enfold them in the love of the community and not, one, enable their disorder, as we've been talking about somewhat, and secondly, avoid their being in a position to do something really damaging to the meeting. We had, in our past, we've had two people, now maybe three, that we had to ask to not be a part of the community because they had done something that really endangered others. So, but this is part of life and certainly part of the life of a friends meeting. We always have to be somewhat aware of that and ready and nurturing. Another thing is that one of the more common disorders is alcoholism. And I've always been glad that for completely other reasons, we've had a long history that we do not have alcoholic beverages at meeting functions and so on. Yeah, not because I'm a teetotaler or anything like that, but I know that having alcohol around places a burden on those who suffer from this disorder. And we may never know who among us is an alcoholic because, it may not manifest that we can see it. But, these folks are here and I'm glad we can make life a little easier for them.
Question would be, what committee or who would take responsibility if we wanted to pursue organizing and training for ourselves and our neighbors?
Care and Council has talked about this problem previously, so I think Care and Council would be willing to do that.
Seems like the right spot.
Not time.
Unless it's housing grants.
Friends, we're out of time.
Very useful.
Thank you.